Today, we're talking about a rare but serious complication, warfarin-induced skin necrosis, WISN. WISN is a life-threatening condition that warrants early recognition and prompt management to prevent severe tissue damage or even limb loss.
Imagine, a drug, right? A drug that's meant to prevent blood clots. Like, that's its job. But then, sometimes, it actually causes them.
It does sound a little backward, yeah.
Right. That's the thing with warfarin-induced skin necrosis, WISN, as they call it.
Sounds kind of scary when you put it like that.
Oh, and that's exactly what we're diving into today. We've got all these research articles, medical summaries, you name it, ready to, really unpack it all.
Yeah, let's break it down.
So you can really get a handle on this, this unusual condition.
Definitely.
So before we get too far, got to ask the basic question. What exactly are we dealing with when we say warfarin? It's a pretty common medication, isn't it?
It is. It is. Warfarin, it's an anticoagulant. Most people just call it a blood thinner. And it gets prescribed all the time, preventing strokes, treating those blood clots you mentioned. And look, it's effective. It really is. But just pretty much any medication out there, it can have side effects.
Right. There's always that little disclaimer, right?
Exactly. And some of them, they're not what you'd expect at all, like you were saying.
So let's get into those unexpected side effects. I mean, we're talking about a blood thinner, and it might actually cause blood clots. It seems almost impossible.
It does, doesn't it? I mean, it just sounds counterintuitive. And that's what makes WISN so interesting, to be honest. You see, in very, very rare cases, warfarin can set off this whole chain reaction in your body, and it actually leads to clotting. And that clotting, well, that's where the skin necrosis comes in. Basically, it's what happens when skin tissue dies.
Okay, so you keep saying rare, but how rare are we talking, really? Should I be, calling my doctor right now?
I don't think you need to panic just yet, but seriously, it's estimated that maybe 1 in 10,000 people on warfarin might experience this.
Okay, 1 in 10,000.
It's serious, definitely, absolutely. But it's not a reason to freak out. I think the real key here, and it's like this with so many things in medicine, is awareness. If you know the risks, if you can spot the signs early, well, it can make a huge difference.
Yeah, that makes sense. Knowledge is power, right?
That's it.
So let's talk about those risk factors. Yeah. Who's more likely to have this kind of paradoxical reaction?
So looking at what we've got here, there are a few key groups that seem to be more susceptible. Statistically, women are more likely to develop WISN than men, and it seems to be even more likely for women who are obese or going through perimenopause.
Perimenopause. Really?
Yeah.
Is there something about those hormonal changes that, messes with how warfarin works?
That's what researchers are leaning towards, yeah. But it does need a lot more study, to be honest. Hormones are so complex, right? They affect so much of what goes on in our bodies, so it makes sense that they might play a role here, too.
That's wild. It's like a whole other layer to think about.
It really is.
Okay, so we've got those risk factors. What else is there? Genetics, maybe?
Exactly. Your genes definitely play a part. Some people just have a genetic predisposition that makes them more prone to WISN. It's like how some people are more likely to get certain diseases, It's in their family history.
Right. So those family trees, sometimes they tell a story, huh?
Exactly. And then there's another thing. How you actually start taking warfarin in the first place. If someone starts on warfarin without bridging with heparin...
Hold on, bridging. What is that?
Yeah, sorry, it's a medical term. Basically, it means they'd start a patient on heparin first. That's another blood thinner, by the way, but it works super fast. And then they gradually introduce the warfarin while also reducing the heparin.
Oh, I see. So it's like easing your body into it.
Exactly. You want to maintain a good balance of those clotting factors, especially in those first few days.
So instead of just slamming on the brakes, you're kind of gently applying them.
Perfect analogy. Think of it this way. Imagine trying to change a flat tire while the car's still moving. You wouldn't just yank the old one off, would you?
No way. I'd probably lose a hand.
Exactly. You'd use a jack, right, for support, and then carefully switch them out. That's kind of what the heparin does. It acts like a jack, giving that temporary support while the warfarin kicks in fully.
Wow, okay. I never thought of it like that. It makes you realize how differently our bodies can react to things, even medications. It's like how some people can down an espresso and be ready to run a marathon, and others 1 cup of coffee and they're ready for a nap.
Precisely. We're all a little different, and understanding those nuances, that's key to good medicine.
Right. So, okay, we're starting to see who might be more at risk for WISN. But I got to ask, Why does it happen in the first place? What's going on inside the body to cause this totally unexpected reaction?
Well, now we're getting to the really fascinating part. See, warfarin, it doesn't affect all those clotting factors at the same rate. In the beginning, it can actually decrease your proteins, C and S. Those are natural anticoagulants, which basically means they're anti-clotting.
Wait, slow down a sec. It's decreasing the body's own defenses before it's fully working as a blood thinner.
You got it. And that imbalance, even if it's temporary, can create what we call a procoagulant state. It's almost like flipping a switch. Suddenly the blood is more likely to clot.
So you're saying it's like taking your foot off the brake before you've even touched the gas.
Exactly. You might get that unexpected jolt forward, right?
Oh, wow. So it's like this chain reaction is happening in your blood, and that jolt is the clotting.
Exactly. You're getting it now. And that's why it's so important to really understand how these things work, you know, for doctors, for patients, for everyone. Yeah, you've got it. It's like this delicate dance. You know, these little things getting out of whack can snowball into something much bigger.
This is all super interesting, but I gotta be honest, kind of makes me nervous too.
I get that.
I mean, if I'm taking something to stop clots, the last thing I want is like the opposite, right?
Exactly. And that brings up a really important point. Being aware, we don't want to scare anyone off, but knowing the signs, that's real power.
Right. Better safe than sorry.
Yeah.
So let's talk symptoms then. What should people be looking out for? Red flags for WISN.
So one thing that comes up a lot in these articles, it's painful bruising. Like, not just your average bump, but often it's described as this purplish rash, purpura, they call it.
Okay, painful bruising, got it.
Yeah.
But I'm guessing not just anywhere, right?
You're right. Seems to pop up most in areas with more fatty tissue. Think like breasts, thighs, your stomach, buttocks.
And it's like worse than a normal bruise.
Way worse. Over time, it gets even darker, like bluish black even. And your skin might even start to blister, could even get open sores.
Okay, yeah, that's definitely not good. Anything else?
There is, actually. It's less common, but WISN can also show up as something called blue toe syndrome.
Blue toe syndrome. Sounds kind of self-explanatory.
Right. Pretty much what it sounds like. Your toes, they get discolored, painful, all because of these tiny clots in the blood vessels there.
So let's say someone's listening, they're on warfarin, and they're freaking out a bit because some of this sounds familiar. What should they do?
I hear ya. It can be scary, but most important is stay calm and act fast. Any weird symptoms, especially like what we've talked about, call your doctor. Seriously, don't wait, don't mess around, just pick up the phone.
Got it. So immediate action, no wait and see approach with this.
Yep. Now, once you talk to your doc, what's next? How do they actually treat WISN?
Well, first thing's got to be stopping the warfarin, right?
You know it. First step's almost always stopping the medication right away. Then it really depends on how bad it is, you know, how far it's progressed.
So it's damage control, then figure out the game plan.
Exactly. Your doctor might try other medications, heparin, remember that from earlier, that bridging thing?
Right.
Or they might use vitamin K. It can help counteract the warfarin's effects.
Oh, interesting.
And if it's really serious, like lots of clotting going on, they might use these things called protein C concentrates.
Protein C, that rings a bell. Didn't we talk about that?
It did. It's one of those clotting factors warfarin can mess with, remember? These concentrates, they help get those levels back in check, kind of like a fast-acting boost to your body's own system.
Like sending in the cavalry.
Exactly. Get things back under control. Now, usually meds are the first line of attack, but sometimes...
And sometimes it's more serious.
Yeah, if there's a lot of skin necrosis, you know, it's spread, then surgery might be needed, or even skin grafts. Basically, got to remove that damaged tissue to help with healing.
Intense. But it's good to know there are options. The doctors have tools to deal with this.
Absolutely. And here's the good news. If you catch it early and get the right treatment, a lot of people with WISN make a full recovery.
That's reassuring.
And this can't be stressed enough, early detection, that's key. That's why we've gone on and on about symptoms, about getting help right away. It can truly make all the difference.
Really makes you think, you know, you got to be on top of our own health.
Absolutely.
Yeah.
Can't just ignore things, especially when it comes to this kind of stuff.
Right. Better to be safe than sorry, like you said.
100%. And you know, what might be no big deal for one person could be a real problem for someone else. It's always different.
That's so true. Trust your gut, and if something feels off, talk to your doctor.
Right. Exactly.
Well, we really dug deep today. Warfarin, this WISN thing, who's at risk, the whole 9 yards.
Yeah, it's amazing when you think about it, how this one medication, warfarin, people take it all the time. It usually works great, but then there's this whole other side.
Right. It's like this hidden complexity.
Totally. Shows you how much we still don't know about how our bodies react to medication.
It's pretty humbling. And it reminds us it's not just on the doctors, right? We got to be proactive, ask questions, speak up. Like we were saying before, knowledge is power.
Couldn't agree more.
Well, on that note, I think we've reached the bottom of the well for today, our deep dive into warfarin-induced skin necrosis. We really hope this has been helpful for everyone listening.
It's been great exploring this with you.
And to everyone out there, thanks for coming along on this journey with us. Stay curious.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.